ready to change dramatically. Some of you in here, many of you, have never actually held a full-time job, other than, in the summer or some meaningless thing in high school. Or this is for real. You're getting ready to join the actual workforce, and that's the way people are going to view you. And the expectations of an employee, while you're not their employee and you're not their worker, this is how they view you. So it's just like I have expectations of all these faculty upstairs, the preceptor is going to have expectations of you. And their tolerance for, well, some of the behaviors we've seen this year is not going to go well. So I'm just kind of giving you a heads up on this thing. Really should be titled, How to Survive the Clinical Year. We had a student this year was in the room with the surgeon and the PA. They were getting ready to go to the OR. And the student blew a bubble. Blew a bubble. And the surgeon turned to the PA and said, "Get that student out of here. I never want to see her again." So, I'm telling you, things are going to be different for you. So I'm going to give you some heads up on some things that I've seen over the last 30 years, just to try to minimize or help you in your survival. Only one student this year has essentially failed a rotation from the preceptor. But it wasn't because of their lack of knowledge. It was because of the things I'm going to talk about here. Okay, so here we go. Before we get to that though, let me just cover some things about the next couple of weeks. To help yourselves. Ultrasound is this Thursday. We have 3 ultrasound machines coming. We're going to have 2 ultrasound techs and a cardiologist is coming. And so you're going to be doing ultrasounds on each other. You're going to be finding all sorts of vascular structures, looking at the heart, looking at the kidneys, all sorts of things. Wear a loose short sleeve t-shirt, like what you have on there, Laura, is because it's open in the top here. Yeah, it's open. I got that right. It's to do the heart, not a short. No, up here is loose enough where you can get the probe in there to examine the heart. You might want to wear a sports bra. Is that what you call them? A sport, the thing I see people run in. Underneath that, we don't want to make anybody feel uncomfortable, so, but you need access for each other. And gym shorts, not the spandex biker shorts, but gym shorts, because you might want to check her femoral arteries out, and so you need to be able to just get under it a little bit. We're not, again, modesty, we want you to pay attention to each other's modesty. We don't want to do anything that's going to offend anybody, but you need access, okay? On the cadaver days, that's Wednesday and Friday. Wednesday, it's got our phone, Brad Smith. We've got all sorts of stuff coming in on Wednesday. You're going to get your hands really dirty up to the elbows in cadaver. These are saline fixed cadavers. They're not embalmed, so they're gonna smell because they're rotting. But they're pliable. They're just like a corpse. So you're going to be putting chest tubes in, and by the time you stick all these holes in body cavities, the odor increases. We're going to put them on ice, and we're going to use them again on Friday, because while some people practice suturing on pig's feet, you're going to practice on people. So that'll be part of Friday, but wear clothes that, you know, you might, at the end of the day, might not want to take home. For casting, now I'm not saying, because they bleed, they're not like embalmed, there's gonna be blood everywhere. Casting next Wednesday. Casting next Wednesday. You want to wear a short sleeve t-shirt because you're going to be putting short arm casts on each other. And gym shorts because you'll be putting splints and maybe a short leg cast on each other as well. So you don't want to wear those legging things.
Yoga pants?
Huh?
Yoga pants?
Yeah, you don't want to wear low yoga pants. You know, those might be okay because they're up high enough, what you have there, but you don't want to wear something tight down to the ankle. For IV and venipuncture, you want to be well hydrated and you want to eat breakfast or lunch. If you pass out, we can take care of you. That's just fine. But the more you're hydrated, the fatter your veins are, so that's good. And you need fat veins because you're not only going to learn how to draw on each other, you're actually going to be the ones drawing for the TB testing. I don't know if you mentioned that this morning, but you're going to be drawing, so there are different types of TB tests. You know, the old TB time test, and a more sensitive test for TB is called quantiferon gold that I told you about this year. You're going to do that. The program's covering the cost of that, but you have to draw 3 tubes of blood on each other. Okay? So you want your veins to be well hydrated. And also a short sleeve t-shirt because the tourniquet. Okay? For sterile technique, we'll give you the directions on where to go. We're going to a surgery center off of Tishomingo, no, that's not, Tecumseh, down in Norman. When you're headed on I-35 South, you take Tecumseh Road, there's the Norman Regional Complex there. It's the next building. I think it's a 3-story building. We'll get you a Google Maps to show you exactly where it is. Go to the 3rd floor, meet in the lobby on the 3rd floor outside the elevators, and one of us will come to take you back to the surgery center. This is a real surgical center. There are 2 scrub techs that are going to walk you through the process. So you might want to wear shorts because you're going to be gowned up.
Don't wear scrubs?
Huh?
Don't wear scrubs?
You don't have to wear scrubs. You can, what you have right there, Randy, is fine. Now, I would shorten the sleeves up because you're going to have to scrub in. So make sure your sleeves don't come down past your elbow. Okay? Tomorrow is a lumbar puncture and a central venous catheter. You might want to wear something expendable tomorrow because the blood, the fake blood in that central line task trainer, once it gets on you, it stains permanent. And if it got on a shirt, it's probably going to, and that stuff gets everywhere. So you might want to wear something, an old t-shirt, an old pair of pants or something, shorts, something. And it'll be over in the anatomy lab. We're going to spend the morning here, and in the afternoon, we'll be over in the anatomy lab. Any questions about what's coming up over the next 2 weeks? All right, it'll be a lot of fun. You'll see. Okay, facts. All of the SCIPPs, which is what the accrediting body calls a clinical rotation, supervised clinical practice experiences. So SCIPPs. These are all functioning, profit-driven enterprises. I say profit-driven, they're not necessarily not-for-profit, because some of them, like St. Anthony's, is a non-profit organization, but you better believe they pay attention to how much money is coming in. So they're in the business, all of these places are in the business to make money because that's how they pay their rent. And that's how they pay their own salaries. If you are doing something to interfere with that, it's not going to go well. You just need to keep that in mind, okay? They're not paid, not a single Skippy preceptor is paid. On the East Coast and West Coast, and many places in between, they pay, the programs pay preceptors $1,000 a month per student. We don't pay it. They're doing it because they want to give back to the profession, or they like education, or they like being around young people. You know, I mean, it kind of keeps you young. But they're not doing it for the money. So that's an important point. If they were doing it for the money, we as a program could put more expectations on them. Like, you're going to do this and this and this because we're paying you to do it. But we're not. They're volunteers. Every one of them is a volunteer. And I hope you, when you get out, you do the same. You know, it is fun to be a preceptor. You should treat this as a job. You should be the first one there and the last one to leave. And you shouldn't have to ask those questions about leaving. If they're there until 10 o'clock, you probably ought to, well, you're not probably, you should be there too. Some of the worst things I hear, worst comments from preceptors I hear, is every day she was asking me when I could leave. Or every day he was asking me this or that. Can I have off this weekend? Can I not be here on Friday? Can I? My response to them is fire their ass. Fire them. Send them back to the program, and if you're fired from a rotation, you get an F. I don't know if that's sign language for an F. If you have any questions about any of this stuff, no, okay? You're on your own here. One of the comments we received this year, it was funny. Somebody in the clinical year says, well, we feel like you guys have abandoned us and you're spending all your time with the first year students. Are you kidding me? You're on rotation now. Your teachers are out there. We are not your teachers anymore. They are. Don't expect us to be your teachers. You're on your own. In a few weeks from now, you understand, you only have a year and a half before you're practicing medicine. It's time to grow up and go. So, your evaluation by the preceptor is directly dependent on those things. When I said that guy failed his rotation, he did not exhibit any of those three things. The preceptor actually told me, I don't know if I mentioned it, she said he got in my way. I've never had a preceptor tell me that in my 30 years of doing this. He got in my way. He didn't do those things right there. If you want to learn and you show an interest in, even if it's something you're not really interested in, I know I'm never going to do pediatrics. But if you show an interest in pediatrics, you're going to come out better. I mean, regardless of what you might think. You know, this year, it's all pretty much objective grading, except for a few subjective things now and then, but pretty much objective grading. Next year, it's all subjective. Every grade you get is purely subjective. They're going to fill out a Likert scale on your attitude, your professionalism, your interest, your everything. It's subjective, completely subjective. The more interest you show, the more you show that you can study. Okay, I don't know the answer to that. Let me go find out. I'll come back tomorrow and I'll give you a presentation on this. I'm serious. That will turn out well for you. If you don't have that attitude, it won't turn out well for you. Okay? Dress. I mean your attire. In the clinical rules and regulations that Professor LaVictoire is going to cover next week, is specific about this. But I just want to tell you that skirts are to be appropriate length, and I think that's defined in the clinical rules, so many inches above the knee. Mid-thigh is not appropriate. It's not appropriate. For the club, yes. For a clinic, no. Guys should show up on the first day with a button shirt, dress shirt, and a tie. If the preceptor wants different attire, you guys can discuss it. Is it okay if I wear scrubs? Or, you go to Hugo, outside of the PA student, there is not a tie in the town of Hugo. If you're not having starch Wranglers, you're out of place. Okay, so in a lot of these places, particularly the rural places, your attire will change to fit the rotation. If you go with Dr. Bondurant in Edmond, he will require you to wear a pressed dress shirt with a tie, because he does. And those are his patients. Any questions about any of this? Okay. End of rotation exams. These things are standardized exams. They come from the Physician Assistant Education Association. We have all sorts of data on these exams from nationwide test takers. You will have to pass 7 of these exams, I think it's 7, before you finish out the clinical year. These exams are not only contain fact-based questions, they have a lot of vignettes. So you're going to have to take it up a notch and do some integration with these test questions, because the answer is something you're going to have to arrive at, rather than what's the color of a rainbow. It's not a fact-based question, it's a thought question. And that's the way the national boards are. Now you're taking the EORs to demonstrate your knowledge in this area, and as a board prep. If you can't pass the EORs, you're not going to pass the national boards. How you pass the EORs, Professor LaVictoire will explain later. If you fail one, you get another shot at it. If you fail the remediation, then you fail the course. You fail the month. So I'm going to tell you right now, these tests are hard. If you put off to the last week studying, you will not pass these tests. You have to take the disease list of a topic, whatever test you're going to be taking. If you're going to be doing internal medicine, there might be 50 diseases on that list. You need to sit down and be regimented enough that, okay, I'm going to take 5 diseases tonight, and I'm going to read in Harrison's or Cecil's or Current's about those 5 diseases, because the test question could come from any aspect of those diseases. That's the way the boards are. The next night, I'll do 5 more. So by the end of the month, I've been through all of the disease list. On top of that, I've looked at board-type questions, the different things that are available to you. But if you blow off these end-of-rotation exams, you will not pass them. We will pay for the first one. They're, I think, what, $35 a piece? 35 bucks a piece. We'll pay for the first one. If you fail it, and we found that this year, the overwhelming reason why people admitted that they failed an exam was because they did not prepare for it. You're gonna pay for the subsequent ones. Okay? Medical practice operations are the business courses. There are 5 of them. You get one hour, at most 1 hour lecture a week. It's an online process. After 9 weeks, you take an exam, or 8 weeks, you take an exam, a written exam, on the end of rotation day. So listen to these audio tapes, make some notes. That's what you need to get by these exams. Do not blow off these 9 lectures to the last week, because you won't make it. The way we remediate those is you come in there and take an oral exam. We had 2 people fail the course this year. It will be how should I describe that? The faculty will be there asking, it's an oral exam, and it won't be fun for you. Okay, do not blow these lectures off. Okay, any questions about that? You'll get more information on it later, but just don't blow these tests off. They have several purposes, and none of the purposes are wasteful. Okay. Dr. Britton.
This just reiterates something we went over this morning. You really do have to sit down at the beginning of your clinical rotations and figure out how to get organized with your time so that you cover what you have to cover. Because it's possible to have an end of rotation exam and an NPO exam on the same day, depending on how it all falls. And if you wait to the last week, like some people did, they threw the NPO exam because they got panicked on the EOR because they really weren't prepared to get ready for either one of them. So day one, you have to be making a plan, and you have to execute it, and you have to stick to it like glue. It's just a professional behavior, and you'll have plenty of chances to develop it.
I tell you, one of the things in PA education that always really bothered me when you compare PA students with medical students. Medical students, during their 3rd year, study probably harder than they even did the first 2 years, because they're constantly looking up the cases they had that day, getting ready for the cases tomorrow. I'm just always impressed with how much 3rd year medical students study. Versus PA students on clinical year were notorious for, well, now that I'm out of the classroom, I don't have to study like I did now. And that leads to an inferior product at the end. This is your opportunity. You got a preceptor. You have a clinician right there, one-on-one, that can teach you an enormous amount of stuff. Take advantage of that. Take advantage of that, because it won't ever happen again. Harassment. You know, with all this stuff going on these days, it hasn't happened in a long time that a student came to me of an instance where yes, that is harassment. We're going to pull you from that rotation. If it happens to you, give us a call. Give Professor LaVictoire or Professor Hughes or myself a call and let us know, and we'll get you out of that situation. It actually happened, we felt that it happened this year with a guy, but the male student did not want to leave the rotation. So he elected to stay and talked it over, and things were fine. But if you're in that situation, you give us a call, okay? You're going to run into a whole bunch of different personalities over the next year. You've got to be flexible in order to roll with this. When you're over here with Dr. Brown, the pediatrician, I swear, he's the funniest, nicest guy on the planet. Then your next rotation is with the Antichrist orthopedic surgeon, who would not like anything better than to see everybody in the hospital die of some horrible disease. Not just patients, but everybody. You gotta be able to go from that to this, to back to that, to this, to back to that. In the workplace, that's what's gonna happen. You wait till you get out and your first referral, you're over here working at the health center, and you're gonna call the Baptist ER. You've got some student you think has meningitis, you wanna refer them to the Baptist ER, and you call the ER to give a report to one of the ER docs, and that guy over there during the day is just a plain asshole. He is a raging asshole. Why did you pick this ER? Why do you think they have meningitis? I mean, it's just, you know, if I ever find him, I'll take a swing at it. That much of a, but I gotta get the student over there. I gotta live with that guy. So, you in your professional life will have to go from the Dr. Browns to the Dr. Orthopedic Surgeon. Not all orthopedic surgeons are like that. There was one time, who was a nice person. Any questions from you guys? I mean, it's gonna, if you get into also a situation where you feel that something's not right, call us, okay? 24/7, call us. We had a student a few years ago, was with a psychiatrist here in town that gave him a script pad that was pre-signed. And he wanted the PA to be there at 8 o'clock. Well, he wouldn't show up until 1 p.m. because he was going out to Remington. But all of these patients would start showing up at 8 o'clock for their Schedule II drugs. And he was wanting the PA student to just write out the Xanax or the Percocets or the whatever. That's obviously not right. And wisely, he called us and we fixed the situation. The guy, I turned the guy into the state medical board. He wound up in all sorts of crazy problems. But if you're getting in a situation you don't feel comfortable, if you're not being supervised, and you don't feel comfortable, then call us. Now, I'm going to tell you this, when you go on rotations out in the rural area, and you're in the emergency room, you know, you're living in the hospital, and a patient comes in with a UTI at 2 o'clock in the morning, or a cough, or a cold, in the emergency room at 2 o'clock in the morning, and you call the physician on call, or the PA on call, who's at home, they may say, well, okay, what do you think's going on? Well, I think they have a UTI, you know, positive nitrites, too numerous to count WBCs, looks like a simple UTI, okay. Call them in something and then have them follow up in the clinic tomorrow. So you may wind up seeing a patient in the emergency room and discharging them with only your signature on it. If that's the way the preceptor wants to roll, you know, I'm not going to blame him a whole lot, because if you weren't there, the only person doing it would be the nurse. Because he's not going to get out of bed to come in at 2 o'clock in the morning for a UTI. But what that should mean to you is that you better make damn sure that was a cold and not meningitis. Or that was a simple UTI and not pyelonephritis. So, there you go. Any questions? Yes, ma'am.
So I know we're gonna have housing in different areas. Do we need to like buy bedding a certain size, like, or they're gonna be twin size to full size, we can bring around sheets, or what do we?
Yeah, I'm gonna address that in my lecture, but I found this, new product on Amazon I think every one of you needs to buy. It's the adult Snuggie, the adult onesie. Seriously, it's an adult sleeping bag, and then, yeah, you're gonna be responsible for your own bedding. I don't have any idea what size the beds are gonna be, but if you got your onesies, you're pretty good to go. I'll have a link on my PowerPoint for you. And I have no disclaimer, no associations to disclose regarding that product.
Yeah, there are a bunch of different housing situations we've arranged. A lot of the accommodations are in hospital rooms, so you'll just go to the living area and grab whatever you need. At our house, we have linens there. There's a washing machine, so you should wash it before the next student arrives when you leave. I don't know what Miss Archer has, or one of the other house. I think Kelly Archer has a maid to come in, cleaning services. It's a woman that comes in to clean up at the end of the month. And she does all the stuff, but it's a lot of different scenes, different circumstances. So if you just go by the philosophy to leave it no worse than you found it, you'll probably be in good shape. So if there's more hair in the shower drain when I go to my lake house than I have on my head, there will probably be another email from me. And that wasn't the worst issue. What else you got?
She may talk about, are you gonna talk about what we need to bring, like, to each rotation, kind of?
As far as what goes.
Just like supplies, like, she said sheets, just like.
Yeah, we'll be talking about that.
Yeah, you want to be really mobile your clinical year, not have a lot of stuff. So. I've known many students that spent the entire clinical phase living out of the trunk of their car and saved all that on rent, their entire clinical phase. When I was in school, I hooked up with four of my classmates, and we rented a one-room apartment. And it was not in a good area of Wichita. We would all come back for the end of rotation day and just slept wherever we could, but that was, saved us a lot of money. The oddest thing, the family that was across the apartment way from it there, it was an Asian family. They were cooking meals in the floor of their apartment. So there was like a fire pit in the middle of their floor. I mean, in the floor. They burned a hole through the floor to the ground. So it's that shows you the area we were in.
I just wanted to clarify your terminology, your phrasing there, Dr. McNeil. Your idea of hooked up might be different than me.
Yeah.
Just wanted to clarify that.
Yeah. There's some generational things going on here. I tell you, one of the most fascinating things is when you get out to these rural areas in particular, find the young people that work in the hospital and ask them to, can I join you guys for whatever? Some of my fondest memories of PA school were in western Kansas, playing volleyball with the locals in Tribune on Sunday evening. Or one night, I remember vividly that we made sopapillas over at somebody's house, and I became part of the community for those 3 months. And it was really a fascinating thing because it was so different than where I grew up in North Carolina. Just if you can get yourself into those situations where, I mean, here I was in July riding a combine during the wheat harvest, which was, we don't have wheat in North Carolina. I remember, I thought tumbleweeds were just the imagination of Westerns. I didn't think there actually was a thing as a tumbleweed. And I was so fascinated with this when I was a student, I boxed a tumbleweed up and mailed it back to North Carolina. I'm not kidding with you. The other thing is I remember at the Oakley, Kansas hospital, it was a U-shaped hospital, and the opening of the U faced north. And during the winter when I was there, the wind was constantly blowing from the north. The entire U of that hospital filled up with tumbleweeds, all the way up to the top of the first, there was a one-story hospital. The tumbleweeds would go up the ramp of tumbleweeds and go over the hospital. The damnedest thing I'd ever seen in my life. One of the best things about rural rotations is that if they let you eat in the hospital, that's what you want. Most of the time they'll feed you. And if you're staying in the hospital, you go down to the cafeteria and eat. Well, rural hospital cafeteria food is made by rural women. And they know how to eat. Some of the food, oh my gosh, I remember the cinnamon buns in Oakley. That was another thing about Oakley. Every morning, these great big old cinnamon buns. You can sit there and eat as many as you want. It's creamy. Creamy. The woman up in Blackwell made the best chocolate chip cookies. They were always hot and always there. And just amazing. Like Britt?
Is there a tumbleweed problem in North Carolina now? You know, from back in now, the Department of Agriculture.
Yeah, probably, yeah. No, well, I don't know whatever happened to that tumbleweed, but it was it was about that big. No other questions? All right, well, we'll see you tomorrow morning. We're going to do HIPAA training at 8. This is something you have to do every year. We'll get your cards back to you. Amber's upstairs scanning them in right now. Let me see if she has them. Can you check to see if she has them?